Meet Jessie and Olivia. They are sisters who live together in Vietnam. Jessie works on a poultry farm, and Olivia works in a restaurant across town. Jessie is leaving for work.
Bye, see you after work.
When Jessie gets to work, the chickens seem fine. Jessie notices some wild aquatic birds nearby. Jessie comes home to a meal and tells Olivia about the sick chickens. Chickens are dead.
Oh man, my hands are kind of dirty.
4 days later, Jessie starts coming down with a fever.
She took some medicine for the fever and tried to go to work, but a few days later, she came home sick with nausea, stomachache, and difficulty breathing. I felt so bad. We went to the hospital that night. The doctors were trying to find out what was causing her breathing problems, so they decided to take an x-ray of her lungs. There was a lot of fluid in Jessie's lungs. I stayed by her side in the hospital.
Jessie was becoming more and more weak at this point.
One of Jessie's coworkers came in later that day to the hospital. The coworker was coughing. I think at one point she was coughing up blood. I went to check on her coworker and the doctors asked how I knew the patient.
Excuse me, how do you know this patient?
I told them it was my sister's coworker. The doctors asked where she worked, and when I told the doctor a chicken farm, both Jessie and the coworker were whisked away.
When we learned that both of these patients worked with poultry and displayed flu-like symptoms, that it could be a form of avian influenza.
Didn't let me visit Jessie. They said it was too dangerous.
Jessie and the coworker are taken to an isolated room in the hospital while they try to figure out what illness they have. The doctors take a swab from the nose and throat from Jessie and the coworker. The doctors run a reverse transcription polymerase chain reaction. The results do not look good. Both patients have influenza A strain H5N1. Influenza A H5N1 is part of the Orthomyxoviridae family. The virus is a single-stranded negative-sense RNA inside a polyhedral capsid. H5N1 virus is very dangerous. It has 60% mortality rate. In some cases, there has been a 100% mortality rate. It has two proteins, hemagglutinin, and neuraminidase hemagglutinin, and is the protein responsible for the virus entering the cell. Even though it does not pass well through people, there has been an instance with human-to-human transmission.
Jessie and the coworker are immediately put on the antiviral agent zanamivir to treat the virus. Zanamivir is an oral inhalation which works as a neuraminidase inhibitor. It is taken in 10 milligram doses every 12 hours for at least 5 days. The antiviral agent works by altering the virus's particles in the body, which causes them to clump up and be secreted in the urine.
During this time, coworker developed severe pneumonia and died. Jessie, however, made a full recovery.
I felt like I was in hell. Everything hurt. When I recovered, they told me that one of my coworkers had died from the same illness that I had. That's really scary to think about, that could have been me.
I was so happy that she was okay.
The doctors told me that I had to carefully dispose of all of our chickens. That was a huge financial loss.
Jessie and the coworker caught the illness from the sick poultry on the farm. The virus is in the bird's saliva, mucus, and feces. The virus can enter the body from inhaling dust particles or mucus droplets that contain the virus in the air, or by touching contaminated surfaces, then touching the nose, mouth, or eyes. Once in the body, the virus attaches to the ciliated respiratory cells. They avoid the host defenses by being intracellular and restricting themselves to the surface of the respiratory tract to avoid antibodies. In the respiratory tract, the virus destroys epithelial cells, which causes inflammation. This leaves the host more susceptible to a bacterial pneumonia infection. The virus exits the host in respiratory droplets. Most transmission to humans is from birds. There are instances of human-to-human transmission. 10 years later, Jesse and Olivia are happily living their lives. Because of the illness, they stopped the poultry farm and found new jobs.
There are ways to prevent catching H5N1. The most effective way is to avoid sources of exposure. Stay away from poultry that may be sick. If not possible, wear person protective equipment, PPE, and immediately wash hands after working with poultry. Do not consume raw or undercooked bird meats or eggs. If someone has H5N1, then take them to get immediate medical care and stay away until they have recovered. If there is a household or community exposure, zanamivir can be used to prevent serious illness. In household exposure instances, zanamivir should be taken once daily for 7 days after last exposure. In community exposure instances, zanamivir should be taken once daily until influenza activity subsides. H5N1 is an epidemic in these 6 countries: Bangladesh, China, Egypt, India, Indonesia, and Vietnam. It's been found in more than 50 countries across the world. There have been no recorded cases of influenza A H5N1 in the United States. However, there was a reported case in North America after a Canadian traveler returned from Hong Kong.